I'm Laura Dedi. I'm the chair of subspecialty care for women's health at the Cleveland Clinic, and I am a reproductive endocrinologist and infertility specialist by training. So infertility is a disease, and it is defined by the timing that a person has spent trying to conceive. Depending on the age of the female, infertility is diagnosed when a couple has been trying conception for over a year, if the woman is younger than 35 years of age. And if the woman instead is older than 35, then even just 6 months attempting conception with unprotected intercourse can be defined as infertility. Unfortunately, it is fairly common. Here in the United States, we can gauge it at approximately 1 to 2 every 10 couples who experiences infertility. We can identify 4 main categories of infertility, which are defined by different risk factors. The tubal factor infertility, uterine factor, ovulatory dysfunction, and male factor. The tubal factor is the most common, and that can be caused by endometriosis, a very common condition of the female pelvis. Now, there's many environmental factors also that are basically acquired and can cause infertility. To name a few, eating disorders that can cause ovulatory dysfunction or excessive alcohol use, radiation therapy or other cancer treatment with chemotherapy, also treatments for autoimmune conditions with chemotherapy, smoking, stress. All these are environmental risk factors for infertility. Contraception does not cause infertility. Their action, their function actually is over as soon as they're removed from the system. So Plan B does not cause infertility. Plan B is basically a hormonal contraception that is an emergency contraception. As far as abortion as a cause of infertility, again, the answer would be no, unless there are complications such as infections. There are several treatment options that we can employ in the treatment of infertility. The first and simplest would be just to induce ovulation with oral medications and allow for a timed intercourse if the semen analysis is normal. Our possibly most effective treatment for infertility and our last resort is performing in vitro fertilization or IVF. In vitro fertilization entails inducing an ovulation that will allow for retrieving multiple eggs out of the female that can be combined with the partner's sperm in the laboratory in a petri dish. And then it will allow for the creation of embryos that are typically cultured up to day 5 of development. And one embryo at a time is then transferred inside the uterus. And the other embryos are typically frozen to allow future fertility in that couple. Because there are many means for us to understand what is the infertility that affects a specific couple. And so there are many treatments that we can implement. Don't give up, because there's always a lot of hope in what we do and the treatments that we can offer for infertility.